Assalamu alaikum. I'm Dr. Mohammed Adil. I'm practicing as a consultant neurosurgeon at Jinnah Hospital, Lahore. I have completed my FCPS in neurosurgery. I'm also providing my services of neurosurgery at Faisal Hospital, Lahore and Mubarak Medical Complex in Sargodha. Neurosurgery is a very diverse field. It deals from trauma as well as it deals with various forms of tumors, congenital malformations. Pediatric neurosurgery is a part of neurosurgery. There can be also some malformations including vascular malformation. There can be various forms of tumors in it. We also deal with this spinal surgery. The spinal neurosurgery is a very vast entity. We in neurosurgery mostly deal with the cases in which there is an anatomic lesion, in which either we correct the lesion or we'll remove the lesion in order to restore the neuroanatomy of the patient. Thank you. Whenever a patient has back pain, he or she has to consult a neurosurgeon. Some patients even go to an orthopedic surgeon, but orthopedic surgeons mostly deal with the bony deformities. If there is any neural element that are being compromised, a neurosurgeon will have a major role in those cases. There are different causes of back pain that can range from disc herniation, which is the most common cause. There can be facet pain. There can be also pain in the paraspinal muscles. There can be pain due to the bony destruction. There can be pain due to slipping of the vertebra over each another. There can be also pain due to some other cause, that is compressing the nerve roots. So this kind of a pain will be, which would compress the nerve root due to any cause, will be very sharp pain, shooting pain, and it would be like electrical pain. Biomechanics is one of the most common risk factors, that is improper bending or posture during lifting heavy objects. It can also be caused while pushing and pulling the objects. There are other risk factors associated like smoking, like obesity and age. And other risk factors that can cause are the trauma. If there is a repeated trauma, it can also lead to chronic backaches. If a patient is complaining with backache which is accompanied with a neurological deficit such as a sensory or a motor deficit, there can be weakness of a specific part, there can be numbness of a part, there can be tingling sensation. Those patients should be seen by a neurosurgeon immediately. There can be other symptoms such as urinary incontinence or urinary retention. These patients should also seek specialist medical advice from a neurosurgeon. Majority of the cases, almost 80%, do not require any surgery. They are treated conservatively, that is with pain medication and muscle relaxing. The patients, if they change their daily habits of posture, they can also get relief from the back pain. But if the back pain doesn't respond to the initial medication, those patients can undergo surgery. In these cases, we have to be very selective because not all cases will respond to surgery as well. There are other options as well, that is the local injection anesthetic blocks are available. In surgery, we can perform surgery in two ways. That is, one is the open, which is more invasive surgery, and other is the endoscopic surgery, which is very minimally invasive. It is an advanced surgery which is even now available in Pakistan. Every surgery has its risks along with its benefit. We weighed the risk versus benefit and then plan for a surgery. Every cause of backache has a different surgery. Every surgery has its different risks. These risks can be from simple wound pain or wound infection, and they can be to a limb threatening conditions like there can be a paralysis of one leg or the other leg, and there can even be urinary or fecal incontinence. Yes, backache is definitely preventable, and it can be prevented by keeping the posture in line, that is not putting much strain on the back, and regular exercise and healthy diet such as fruits, citrus fruits, especially vitamin C is very necessary for the ligaments, and calcium is very important for the bones, and it should be included in the diet. Different surgeries have different recovery time. If a minimally invasive surgery is done, the recovery time is almost 1 day. If more invasive surgery is done, the recovery time will eventually increase. It also depends on the initial condition of the patient. That is, if the patient has got some deficit, it is very less likely that the deficit would improve. There would be some remnant deficit after all. But if the patient is perfectly fine before surgery in terms of neurology, that is, pain is the only condition, those patients will recover faster. If a patient is coming with complete paralysis of the lower limbs or loss of the sphincters, it is less likely that the patient would have any benefit in these cases. If the patient is having back pain, it can definitely become a permanent disability. In cases, the most common cause, that is the disc herniation. If there is a large disc which is compressing the lower spinal nerves, it can cause cardiac venous syndrome, which can cause paralysis of both the lower limbs as well as loss of sphincters, that is urinary and fecal incontinence. In order to have a healthy life, all of us should adopt healthy activities such as exercise, the weight should be controlled, and smoking should be prevented. These all the people should have healthy diet, which would include calcium and vitamins, so that the bones would be healthy as well as the ligaments would be healthy. We should adopt such practices in which our posture does not cause strain on the back.